The human body has 650 muscles, 33 nerves, 360 articulations, and 206 bones. During the day, we use these different parts of the body for moving and making different types of activities. However, there are 27 bones and 11 muscles that we use most often than the others, because they are part of the superior limbs of the body, being the fourth segment of the upper limb, or better known as the hand. The hand is one of the members of the body that is more prone to get an injury, due to the fact that we use it every single day to make different activities as writing, cooking, carrying, throwing, sewing, and many others. Injuries are changes that are perceived in the bone structure and in the morphological of the body. This term is commonly used when there was a fall, hit, burn, and other. There are two types of injuries, the chronic ones and the sharp ones. The chronic ones are injuries that last the most and take time to produce some pain. Therefore, their rehabilitation is longer. The most common ones in hand are the carpal tunnel syndrome, the tunnel pain, and the crevatin syndrome. The sharp injuries are the ones that are generated in a punctual moment, and the time of rehabilitation is shorter. The most frequent sharp injuries in hand are bruises, tendinitis, fractures, dislocations, ligaments, injuries, among others. Hand injuries are produced more often when recreational activities are practiced, or when it's been done home activities, or by any fall, fight, or on bad postures. Injuries happens independently of the age, however.
Older adults have more risk of having an injury as they lose muscle strength and bone mass,
which makes more injuries. However, every type of injury makes pain due to the constant use of the body every single day. However, a hand injury not only gives a daily pain, but it can also mean an incapacity. That is why the rehabilitation is really important, but the equipment for the rehabilitation does not exist or is really expensive. During the investigation, we find out that the prostheses are not autonomous, few commercialized, and the range of cost is from $3,000 to $8,000.
Hi, we are Andrea
and Mariana from Cumbres International School Lomas,
and this is our project
Robo-Health.
Robo-Health is an alternative proposal that will be built with an intelligent system that is built with 3D impressions and controlled by an Arduino, which makes it a resistant but a lightweight and also low cost. This will help preventing the loss of motor skills in the hand, and the project is mainly directed to low-income people. But why Robo-Health? Well, in 2016, the Instituto Mexicano de Seguro Social, or better known as IMSS, registered 1,871 cases of hand injury, but unfortunately, more of the 80% of the patients left their rehabilitation due to the lack of equipment and money to continue the rehabilitation. This problem let us see that the rehabilitation of the upper and lower extremities of the body in the low or middle income countries like Mexico is more often blocked due to the lack of clinical resources and funding being a great obstacle for rehabilitation. Nowadays, robotics is being more used in medicine and in therapies because it gives a consistent and precise treatment during a more time treatment. Also, these treatments have proved that they are more effective because they can be programmed in different velocities and modes, which makes it more versatile. Treatment leading to more options to treat an injury. Robots also provide more information during the treatment as they measure and register the behavior of patients' injury. That is why, when we saw this problem and the opportunity of making a cost-effective solution for hand rehabilitation that can make an individualized rehabilitation in superior limbs by creating a program through the Arduino that is capable of controlling a therapeutic prosthesis constructed by a 3D impressions that is capable of achieving a correct rehabilitation previously prescribed by a doctor. Robo-Health is divided in two parts. The first one, that is the prosthesis that rehabilitate the knuckles, that comes with three different therapeutic modes that vary in velocity and angle in which the prosthesis moves. Each mode is represented with a different LED color. The second part is a prosthesis that rehabilitates the phalanges and the wrist, and the elaboration of a remote control, which will facilitate the use of the prosthesis. However, the second part was intended due to the pandemic, leaving this part for the future accomplishment. The first part of the project. The prosthesis was constructed by the instructor previously designed in a Tinkercad and then printed in the 3D printed, automated with servo motors and programmed by IDE Arduino. The material used were not only the programs of Tinkercad or IDE Arduino, but also it was used an Arduino, two servo motors, one protoboard, 3 LEDs, and a 3D printed filament and cables for the Arduino, a Velcro silicone to join the pieces. For the prosthesis, first we design each piece in the application of Tinkercad, then we print them each one in the 3D printer, then we join the pieces with silicone. Then we insert the Arduino, the protoboard and the servo motors, which were joined with the cables. Then we program in the application of IDE Arduino. Robo-Health is an alternative therapy used for the rehabilitation neuromuscular that can help the patients to regain hand mobility through the motor relearning. Robo-Health is an automated device that is available to all public because it is manufactured with 3D printed structures and with an Arduino that encode therapeutic routines. In this way, Robo-Health is economic, which makes a most affordable rehabilitation. Robo-Health has 3 different modes of therapy that help the therapist and the patient to make personalized rehabilitation. The velocity of each mode can be selected depending on the necessity of the patient, making the process of rehabilitation faster by helping the patient since the very beginning, helping the patient complete the up and down movement. So, while living with a pain, if there are proposals as Robo-Health that, although it hasn't achieved its potential, it will help you to have an automated and economic therapy.